After more than 30 years of working with patients over 50, I've realized something interesting. The type of blood pressure monitor you use isn't nearly as important as how you use it. I once had a patient, Mary, who was 67. She bought an expensive digital monitor and measured her blood pressure every day. But the numbers kept jumping up and down, leaving her anxious and even unable to sleep. When I asked her more carefully, it turned out she often measured in a rush, sometimes right after finishing her coffee, sometimes with the cuff too loose, and often with her legs crossed. And just like that, those little details threw her readings completely off. The truth is, the key to accurate blood pressure measurement is staying calm and doing it the right way. Take a few minutes to relax, sit with your feet flat on the floor, keep the cuff at heart level, and only then start the measurement. It's a bit like listening to a piece of music. If the room is too noisy, you'll miss the subtle notes. A blood pressure monitor works the same way. It needs quiet and precision to tell you the real story of your heart. So before you get caught up in the debate of manual versus digital, remember this. The machine is only a tool. What really determines accuracy is how you treat your body in that very moment of measurement. I remember one afternoon, James, 72 years old and one of my longtime patients, came in for a checkup and chuckled, "Doctor, this digital machine is a lifesaver for me. I just wrap it on, press a button, and in less than a minute I know my numbers. No straining to hear faint sounds, no worrying about whether the cuff is in the right spot." I looked at him and saw the relief written all over his face. For many older adults, complexity itself is the barrier that makes them give up, and the digital monitor takes that burden away. The convenience isn't just about speed, it's about helping you stay consistent. Let's be honest, if something feels like a chore with too many steps, most of us won't keep it up. But when it's simple, you're far more likely to make it part of your daily routine. And that consistency, over time, becomes the real medicine. Catching changes early and acting before a small problem turns into something serious. Now you might be wondering, but are they really accurate? The answer is yes. If you choose a clinically validated device and use it properly, digital monitors can be very reliable. And sometimes that sense of ease and peace of mind is exactly what keeps you committed to caring for your heart. When I think about manual blood pressure monitors, I can't help but go back to my early years as a medical resident in the hospital. I always carried a stethoscope and a mechanical blood pressure cuff in my coat pocket. Back then, it wasn't just a tool. It was a silent teacher, training us to truly listen to the heart. Every beat, every faint sound as the air escaped carried meaning, a language that only patients could translate. That's why manual monitors became the gold standard in hospitals for decades. They don't need batteries, they don't break down from faulty electronics, and when used correctly, their accuracy is hard to beat. I remember once taking a reading for an older patient, and, by listening closely, I picked up on an irregular heartbeat, something a digital machine at that moment might have missed. Sometimes the difference lies in those tiny details. Of course, not everyone has the patience or the skill to use this kind of device. Place the cuff wrong, mishear a sound, or try to measure in a noisy environment, and the result can easily be inaccurate. But for doctors and nurses, the manual monitor remains the most trusted tool, especially in clinical situations where precision is absolutely critical. These days, with medical technology advancing so quickly, digital blood pressure monitors aren't just about showing you two numbers anymore. I once had a patient named Linda, 65 years old. She was always anxious about her blood pressure, but when she switched to a digital monitor with memory and irregular heartbeat alerts, she told me, "Doctor, now I feel reassured every time I measure. I don't just see the numbers. I know the machine will warn me if something seems off with my heart." That's the real difference. Modern devices can store weeks of readings, and in some cases, even send the data directly to an app where your doctor can follow along. For older adults, especially those who forget easily or don't like keeping manual records, this is a real advantage. And when you look back at a chart over the course of a month, you can see the trends clearly, whether things are creeping up or staying steady, something a single isolated reading can't reveal. These smart features also take away much of the stress. Instead of worrying, "Am I doing this right?" you have a machine handling most of the work. It's like having a quiet companion by your side, helping you keep track of your heart with ease. And sometimes that sense of reassurance is just as valuable as the numbers flashing on the screen. I still remember a patient once asking me, "Doctor, do I really need to spend $100 on a blood pressure monitor when the pharmacy sells one for just a few bucks?" It's such a simple question, but honestly, it's one that many people wrestle with. The truth is, manual monitors are usually cheaper, sometimes under $30, while digital monitors, especially those with Bluetooth or memory storage, can cost $70, $100, or even more. But the issue isn't just about price. I often tell my patients, that device isn't just another gadget, it's an investment in your heart health. If a monitor is easier to use and encourages you to measure your blood pressure regularly, the value can far outweigh the cost. In fact, it might even help prevent something as serious as a stroke or heart attack down the road. Of course, no one wants to overspend. But think about it this way. The cost of one morning coffee every day over the course of a month could add up to the price of a reliable blood pressure monitor. And if you ask me, your heart is worth far more than that. And it deserves to come first. Many patients have asked me, "Doctor, so which one should I buy? Manual or digital?" And I usually smile and say, why not use both? It may sound unnecessary at first, but in reality, it's one of the smartest and safest approaches. Here's how it works. At home, you can use a digital monitor every day. Fast, simple, and stress-free. Then, when you visit your doctor, your readings can be checked again with a manual monitor, the gold standard in clinical practice. Comparing the two not only verifies the accuracy of your home device, but also gives you peace of mind that you're not relying on a number that could be off. I remember one of my patients, Richard, 70 years old. He was very disciplined about his health. Every morning he measured his blood pressure with a digital monitor and kept notes. When he came to see me, I would measure again with a manual device and compare. That combination helped us notice when his home machine started drifting and needed recalibration. Because of that, Richard was always able to keep track of his blood pressure both accurately and consistently. Sometimes the answer isn't about choosing one over the other. It's about letting both tools work together, like two companions walking alongside you to help protect your heart. I remember taking a blood pressure reading for Helen, a 68-year-old patient. As I placed the stethoscope on her arm, I noticed her heartbeat was irregular, pausing here and there like a song skipping a note. If we had used only a digital monitor that day, we might have missed this important detail. In fact, she was later diagnosed with a mild arrhythmia. This is the greatest strength of the manual monitor. It allows doctors, nurses, or anyone with experience to actually listen to the story of the heart. Those faint sounds, those subtle shifts in blood flow, things a digital machine may never capture, can be detected by a trained human ear. I often tell my patients, a digital monitor is wonderfully convenient, but a manual one is like a classic violin. It demands skill, but when played correctly, it reveals layers of nuance that technology simply can't replace. That's why so many hospitals and emergency rooms remain loyal to the manual monitor in situations where precision and human judgment matter most. So if you ever see your doctor patiently checking your pressure with an old cuff and stethoscope, don't think of it as outdated. In truth, it may be the moment your heart is being heard in the most genuine way possible. I once had a patient named David, 66 years old. He preferred using a wrist blood pressure monitor because it was small and easy to carry while traveling. But one day he came into my office, worried, saying his blood pressure had suddenly shot up. Every reading was unusually high. When I checked him with a manual upper arm cuff, the results told a very different story. His blood pressure was perfectly stable. The reason? He had been holding his wrist lower than his heart, and the wrist monitor had exaggerated the numbers. This is something many people don't realize. Wrist monitors are far more prone to error. The arteries in the wrist are smaller, closer to the skin, and very sensitive to positioning. Even a slight drop of the wrist, or not keeping it steady, can throw the reading off by dozens of points. In contrast, an upper arm cuff, when fitted and placed correctly, is usually much more reliable. That's why I often advise my patients, if you want the convenience of a digital monitor, choose an upper arm model, especially those certified by the American Heart Association. Wrist monitors can be useful in special situations, but they should never be the sole tool for making treatment decisions. because sometimes a single false reading is enough to cause unnecessary anxiety. After everything I've shared, I truly believe there's no such thing as a perfect blood pressure monitor. What matters most is how you use it, the patience to measure correctly, the consistency to track your numbers, and the willingness to listen to your body every single day. Whether you choose manual, digital, or a combination of both, the ultimate goal is the same: keeping your heart at peace and your life a little lighter. I want to invite you to pause for a moment and ask yourself, have I really been paying attention to my blood pressure every day? When was the last time I measured and wrote down those numbers? Your answer could be the first step in a new journey, a journey toward better health, longer years, and greater peace of mind. And please share your story with me, because every story, no matter how simple, is like a spark that helps light the fire of a community living healthier, with stronger hearts and calmer days. If you found my words helpful, don't forget to hit like to support the channel and subscribe so you won't miss the next video. I'll see you soon.